So this is a really great question. So the truth is we don't have great studies that tell us the exact percentages of women who have trouble breastfeeding after a breast reduction. You certainly can breastfeed in many situations. So as a surgeon, here's the things that I do to try to preserve your ability to breastfeed. So in truth, doing the surgery properly in my mind is going to increase your chance of breastfeeding. So if you do the surgery in a way to preserve the nerve supply to the nipple as best you can, and also preserve a decent size of breast tissue attached to the nipple, that is going to lead to you being more likely to breastfeed. There's a few things that we may not be able to control that can reduce your chance of breastfeeding. And one of those things is a very, very low nipple. So if the nipple is low and your pedicle, or the tissue that's left behind, is quite long and we have to kind of bend it, that bend sometimes affects the ductal tissue and it makes it less likely that you can drain that milk and breastfeed. We do believe, however, though, that sometimes the body can kind of figure things out and nerves can regenerate and the ductal tissue can also grow and change. And sometimes women, even with very large breast reductions that have a lot of bending of their pedicle, can still breastfeed without issue. So in your comment, you ask about removing the nipple and putting it back on, and we call that a free nipple graft. That technique is not common in my experience. I've actually never seen one, not even in my training, and I finished my training 13 years ago. And that's where we remove the nipple and put it back on as a skin graft. And that used to be done more commonly for very low breasts or very large breast reductions. You can safely preserve the nipple in many people with those situations, so I don't use that technique at all. Now, if you've had that technique done, there is really no possibility of breastfeeding because you completely disconnected the nipple from the system that makes the milk. So that's one of the downsides of that technique. So if you've had a breast reduction and you're interested in breastfeeding or trying to breastfeed, I always recommend meeting with a lactation consultant before you have the baby. It's really hard when you have a newborn hungry baby and you're emotional and crying and recovering from childbirth to manage feeding difficulties. And I think it's great to have someone at your fingertips to help you. And they see this all the time. Breast reductions are very common. They have lots of tips and tricks for helping women increase their milk supply and manage all the issues we see with breastfeeding. So get them on your team beforehand. It's sometimes, like in my geographic area, very difficult to get in with them. So you want to make sure you make an appointment weeks in advance. And that way, again, you have that resource.